Hi friends, welcome to the channel The Nurse. Here we are discussing about a second part of system-wise nursing MCQs. So we have discussed first part. In that we have already discussed the questions about a gastrointestinal system, nervous system, etc. So here we will discuss balance systems. So we will move to the topic System-Wise Nursing MCQs Part 2. Here we will discuss about cardiovascular system. Some questions we were discussed in previous video. So balance question we will discuss here. And respiratory system questions, endocrine system, reproductive system, integumentary, and two or three general questions. So we will move to the first question. Which of the following is a type of blood cell that plays a key role in blood clotting? It is an easy question. Red blood cells, white blood cells, platelet, plasma. So correct answer is platelet. It is a simple question. So platelet helps to blood clotting. Platelet also known as thrombocytes. They are small blood cells that play a crucial role in blood clotting and wound healing. Second question. What is the name of the wall that separates left atrium and left ventricle? Left atrium and left ventricle. Which wall is separates? Mitral wall, tricuspid wall, pulmonary wall, aortic wall. Correct answer is mitral wall separate left atrium and left ventricle. So we will discuss in detail. So here the anatomy of the heart. So mitral wall, this is a left atrium and left ventricle. So from the left atrium, blood is coming through mitral wall. This is the mitral wall. So mitral valve is bicuspid valve. It is also known as bicuspid valve. All other valves have three cusp-like structures to prevent the backflow. But in the case of mitral valve, it has only two cusps. So it is known as bicuspid valve. The mitral valve was also known as bicuspid valve, separates the left atrium and left ventricle, ensuring blood flows in one direction. So only blood flow from left atrium to left ventricle. It will not go back to left atrium. So in other structures I can explain here. So this is a mitral valve that is separates with the left atrium and left ventricle, and there is a tricuspid valve that is located between right atrium and right ventricle. So it also known as tricuspid valve, and there is another two valves. One is opening of the aorta, that is known as aortic valve, and another is pulmonary artery. That valve is known as pulmonary valve. So we will discuss in short about that valve also. So first tricuspid valve that is located in right side. I told you it separates right atrium and right ventricle. Tricuspid valve is located on the right side of the heart. It separates right atrium, that is upper chamber, from the right ventricle. The tricuspid valve has three cusps that prevent blood from flowing backward into atrium during ventricular contraction. When it closes, it produces the first heart sound. So tricuspid valve closure makes first heart sound S1. Then another valve, that is aortic valve, it opens into aorta. So left ventricle, the blood pumps into aorta, then it will prevent the backflow. Aortic valve will prevent the backflow. The aortic valve is situated on the left side of the heart. It separates the left ventricle from the ascending aorta, the large artery that carries oxygenated blood to the body. The valve ensures that blood flow from the left ventricle into the aorta during ventricular relaxation. When it closes, it produces the second heart sound, S2. So S1 due to closure of the tricuspid valve, S2 is due to closure of the aortic valve. Then I told you another valve, that is pulmonary valve, that is located at the starting of the pulmonary artery. The pulmonary valve is also known as right side of pulmonary valve, also on the right side of the heart. it lies between right ventricle and pulmonary trunk, which leads to the lungs. The pulmonary valve has three cusps and prevents blood from flowing back into the right ventricle. When it closes, it ensures that blood is directed towards the lungs for oxygenation. So deoxygenated blood carries from right ventricle into lungs by pulmonary artery. The backflow of deoxygenated blood is prevented by pulmonary valve. So here I have uh, explained about four kind of valve. Third question, which of the following is not a part of the upper respiratory tract? Nose, mouth, pharynx, bronchi. Correct answer is bronchi. Bronchi is not a part of upper respiratory tract. The upper respiratory tract consists of nose, mouth, pharynx and larynx, while the bronchi are the part of the lower respiratory tract. Upper respiratory tract, it includes nasal cavity, sinuses, pharynx, larynx, that is located above the vocal cord. Located upper respiratory tract located in the face, head and neck, responsible for air intake. Lower respiratory tract comprises trachea, bronchi, bronchioles and lungs. It found in the neck and chest. It leads to lungs for gas exchange. It is a simple physiology, anatomy and physiology. Next, fourth question. What is the name of the membrane that separates lungs from the chest cavity? Pleura, pericardium, peritoneum, diaphragm. So here correct answer is pleura. Pleura separates lungs from chest cavity. Same time, pericardium that covers the heart, peritoneum that covers the abdominal organs, diaphragm that separates thoracic cavity from abdominal cavity. The pleura is a thin membrane that surrounds the lungs and lines the chest cavity, allowing for smooth movements during breathing. So pleural fluid will be there inside the pleura. So it prevents the friction and it helps to smooth movement of lungs inside chest cavity. Next question, what is the primary function of the integumentary system? So we move to integumentary system to regulate body temperature, to protect the body from external damage, to aid in the production of vitamin D, all of the above. Here correct answer is all of the above options are correct only. All of options are the functions of integumentary system, that is regulate body temperature, protect body from external damage, to aid in the vitamin D production. The integumentary system comprises skin, hair, nails and associated glands. It performs multiple functions including protection, temperature regulation and vitamin D production. Sixth question, which layer of the skin is responsible for pigmentation? Epidermis, dermis, hypodermis, subcutaneous tissue. Because of the pigmentation, the persons will get that particular color to the skin. So that may be white, black or pink. These are due to pigmentation of the skin. So which layer is helpful for giving pigmentation? So correct answer is epidermis, that is the superficial layer of the skin. The epidermis is the outermost layer of the skin, contains melanocytes that produces melanin, that is responsible for skin pigmentation. So epidermis is the outermost layer or superficial layer that contains melanocytes. This melanocytes produces melanin. It gives responsible for skin pigmentation. If melanin production is more, the person's skin will be dark. If melanin production is less, that a person's skin will be white color. So seventh question, what is the name of the nerve endings in the skin that detect touch and pressure? Meissner's corpuscles, Pacinian corpuscles, Merkel's disc, Ruffini endings. So this question is a little moderately difficult. So correct answer is Meissner's corpuscles. So Meissner's corpuscles detect touch and pressure. Meissner's corpuscles are the specialized nerve endings in the epidermis that detect light touch and pressure. Eighth question, which of the following is a function of the sebaceous gland? To produce set, to produce sebum, to aid in the production of vitamin D, to detect touch and pressure. So in these options, we can easily avoid last option, to detect touch and pressure, because it has a function of Meissner's corpuscles. So we can avoid that. So in balance three options, which one is correct? So here correct answer is to produce sebum. Sebaceous gland helps to produce sebum. Sebaceous gland found in the dermis. Dermis is the second layer of the skin below epidermis. It produces sebum, an oily substance that helps to moisturize and protect the skin. So in the dermis, sebaceous glands are located. Sebaceous glands produces sebum. It helps to moisturize and protects the skin. Ninth question. What is the name of the condition characterized by excessive sweating? Hyperhidrosis, hypohidrosis, eczema, psoriasis. Correct answer is hyperhidrosis. Hyperhidrosis is a condition marked by excessive sweating, often affecting the palms, soles, and armpits. So, because these are palms, soles, and palms and soles are usually not that much sweats are produced. So, but in the case of hyperhidrosis, there also excessive sweating will be there. Then 10th question, what is the primary function of the hormone thyroxine? So we entered into endocrinology system. What is the primary function of the hormone thyroxine? Regulate growth and development, control metabolism, maintain electrolyte balance, stimulate adrenal function. Here correct answer is control metabolism. Main function of the thyroid hormone, that is control metabolism. Thyroid hormone or T4 is produced by the thyroid gland and it plays a crucial role in regulating metabolism. You can look into that thyroid hormone functions. So you will get that detailed functions. So here I just superficially touched that function. Otherwise, you can comment all the functions of thyroid gland in our comment section. Which of the following endocrine gland is located in the brain? Pituitary gland, thyroid gland, adrenal gland, pancreas. It is an easy question. Correct answer is pituitary gland. Pituitary gland is located in the brain. Pituitary gland is often called master gland. It is a debatable topic because some people telling hypothalamus is the master gland, but some people may tell pituitary gland is the master gland because most of the hormones are produced from pituitary gland. Pituitary gland regulates the functions of many other endocrine glands. So all the stimulating hormone is produced by pituitary gland, that is by master gland. Example, thyroid stimulating gland, thyroid stimulating hormone or growth hormone. These are hormone produced by pituitary gland. 11th question. What is the name of the hormone produced by adrenal gland that helps the body respond to stress? Cortisol, aldosterone, adrenaline, insulin. So correct answer is adrenaline. Adrenaline, also known as epinephrine, is produced by the adrenal gland that helps the body respond to stress. So mainly adrenal medulla. Adrenal medulla produces adrenal gland, adrenaline and noradrenaline. Same time, what are the hormones produced by adrenal cortex? You can comment it below. Which of the following is a symptom of hypothyroidism? That is underactive thyroid gland. Weight loss, increased heart rate, fatigue, excessive sweating. Please go through the question. That question is hypothyroidism. So correct answer is fatigue. All other symptoms are associated with hyperthyroidism. Fatigue is related to hypothyroidism. Hypothyroidism can cause fatigue as well as other symptoms like weight gain, dry skin, and hair loss. In the same time, in hyperthyroidism, there will be opposite symptoms. So there will be weight loss, and excessive sweating will be there, and hair loss we cannot exactly tell in the case of hyperthyroidism. There is a chance of hair loss in hyperthyroidism. Then 13th question, what is the primary function of the hormone prolactin? It regulates growth and development, controls milk production in lactating women, regulates metabolism, maintains electrolyte balance. So correct answer is it controls production in lactating women. So which hormone helps to eject the breast milk? You can comment it below. So one hormone is for production, one hormone is for ejection. So which hormone helped for ejection of breast milk? You can comment it below. Prolactin is a hormone produced by the pituitary gland that stimulates milk production in lactating women. So milk ejection is controlled by hormone that is oxytocin. Okay. 14th question, what is the primary effect of the hormone cortisol on the body? It regulates growth and development, controls metabolism, helps the body respond to stress, regulates milk production. So cortisol also helps the body to respond against stress. So mainly adrenaline and noradrenaline helps in the case of stress, but in some cases, cortisol also plays some role in managing stress level. Cortisol is also known as stress hormone produced by the adrenal gland, that is adrenal cortex, that helps the body respond to stress, regulating blood pressure, metabolism, and immune function. 15th question, which of the following is a function of the prostate gland in the male reproductive system? To produce sperm, to produce testosterone, support erectile function, to produce fluid for semen. So we reached into reproductive system. So this question is from male reproductive system. So here correct answer is prostate gland helps to production of semen production. So it helps to produce fluids for semen. So it increases the fluid level in the semen. Prostate gland produces fluid that makes up a significant portion of the semen, which carries sperm out of the body. So sperms moves through the body along with the fluids. So that is produced by prostate gland. What is the name of muscular tube that carries sperm from testis to the penis? So this is a testis. So from here the sperms produced, then it carries to penis. So that tube name is asked in question. So which one? Vas deferens, epididymis, urethra, seminal vesicle. Correct answer is vas deferens. The vas deferens is a muscular tube that stores and transfers sperm from testis to the penis. 17th question. Which of the following is a function of the cervix in the female reproductive system? To produce eggs, to support fetal development, to regulate menstrual cycles, to allow passage of sperm. Correct answer is to allow passage of sperm. That is the main function of the cervix. Cervix allows sperm to enter the uterus where fertilization can occur. So fertilization is occurred at which part of the uterus? That is another question. So you can comment it below. So that is a repeated question. That is why I asked. What is a term for the surgical removal of the uterus? Hysterectomy, oophorectomy, mastectomy, salpingectomy. So it is an easy question. So you can easily answer here. That is hysterectomy. Surgical removal of the uterus. That is hysterectomy. Hysterectomy is the surgical removal of the uterus, often performed to treat conditions like uterine cancer or fibroids. So hysterectomy usually indicated in the case of uterine cancer or uterine fibroids. And you can comment some other options also in the comment section. So indications for hysterectomy. Two indications I have mentioned here, that is uterine cancer and fibroid uterus, and other indication you can comment. 19th question, how many zones are there in Indian Railways? 16, 18, 20, 22. This question is from general knowledge. So here correct answer is 18 zones are there in Indian Railways. Indian Railway is divided into 18 zones with the recently added South Coast Railway Zone in 2019. Next question. Where was the first metro rail started in India? New Delhi, Mumbai, Kolkata, Hyderabad. So this is our last question. So correct answer is Kolkata. The first metro rail started in Kolkata. Kolkata is the first metro system in India. With Kolkata Metro is the first metro system in India with its first service inaugurated in 1984 by former Prime Minister Indira Gandhi. So that is about today's video. If you have any doubt in these questions means you can ask in comment section. So till then, bye bye. And a railway and Navodaya Vidyalaya exam is coming. So please prepare it well. So thank you. We'll see you with another video.